Morning I start about 8 to 9.
Okay. ബാക്കി മൂന്ന് മെസ്സേജും കിട്ടി നാളെ രാവിലത്തെ കഥ അദ്ദേഹത്തിന് ശ്യാമലിന് കൊടുത്തു.
You can come straight to the Eastern Road.
അത് പറഞ്ഞു. He will do എന്ന് പറഞ്ഞു.
Thank you.
Mohandas sir, shall we start now? Others will join, I think.
Okay. Good evening, all. Today, we are having a program, Beyond Horizons Meet the Doyens, which is an IAP Kerala program organized by IAP Calicut. And I would like to welcome all who have joined with us. Today's talk is by MKC Nair sir. I had the good fortune of being his student. I did my post-graduation in SAT Hospital. And it was a very pleasant experience to work with him. He was instrumental in doing the breastfeeding practices there at that time. And he insisted to have neonatal resuscitation corners all over Kerala, in all institutions, wherever even a single delivery is happening. And when we went for various conferences outside the state, Kerala was mainly known by MKC sir. And he became the first national president of IAP from Kerala and Vice Chancellor of UHAS. And this is a MKC sir is the best person to talk on today's topic. I would like to welcome MKC sir to this gathering. Among the audience, we have senior pediatricians, PK sir, and today's moderator is Dr. Krishna Kumar, who is the director in HANS, and he also is has done a lot of work in child psychiatry and also in adolescent psychiatry. And I would like to welcome Dr. Krishna Kumar to this gathering. And I would like to welcome each and every person in this gathering. PK sir, Dr. Ajit, HOD, Pediatrics, Calicut, Dr. Geeta, Priya, Dr. R.R. Verma, Dr. Parameshwaran. So I would like to welcome all. And I would like to request Dr. Krishna Kumar to introduce the topic and also moderate the session.
Hello. For this audible, respected chief guest of the day, Dr. MKC Nair, senior pediatricians, teacher Shachiran sir, Dr. Parameshwaran, Ajit, and dear friends. It's a great privilege for me to moderate a session which is handled by Dr. M.K.C. Nair, former Vice Chancellor of Kerala University of Health Sciences, and the past President of National President of Indian Academy of Pediatrics, also National Neonatal Forum, Incline Trust. And I also thank the IAP Calicut and IAP Kerala for this opportunity to moderate this session. MKC sir is today introducing the concept of preconception counseling and also preconception care. We are all familiar with the concept of prenatal care, but the preconception counseling is a new concept or a new idea, new terminology to many of us. And WHO defines preconception care as a health intervention to women and couple before conception. And the interventions may be biomedical interventions, behavior interventions, and social interventions. Preconception counseling aims to improve the health status of women and also to reduce behaviors and risk factors, both individual risk factors and environmental risk factors that can lead to poor maternal and child health outcome. And the ultimate aim is improved or better maternal and child health, not only in the short term, but in the long term also. With this introduction, I invite MKC sir to present the topic. I don't want to list the achievements, honors of MKC sir. It will take, we all know, and it will take the whole hour. And but I would like to say, recently, we can all be proud that last year he was awarded the Doctor of Science by Kerala University, and also the fellowship of National Academy of Medical Sciences, both probably first time for a pediatrician from Kerala. And the DSC probably first time for a medical person. So we are all proud of you, sir. And many of the innovative concepts which sir has introduced has become part of our daily routine pediatric practice, like adolescent care, newborn care, early intervention, developmental therapy, etc. So I am sure that this preconception counseling is also going to be a part of our routine practice in future. Over to you, sir.
So good afternoon, good evening to all. Can you hear me? You can hear me?
Yes, sir.
Yes, sir. Yes, sir.
Okay. 40 years ago or 45 years ago, some of us pediatricians were obsessed with developing neonatal services. And I must take name of Dr. Sachisa, C.K. Sachisa, for doing that great job in Calicut. I think Malabar side, probably he was the only one doing that. And probably in the south, myself, Dr. PMC Nair, all were trying to develop neonatal care. At that time, many pediatricians didn't believe that. I'm talking about 40, 50 years ago. Didn't believe that newborn is, actually we should be spending so much energy on the small babies. But then that became the reality. We were talking about, at that time, we were talking about the breastfeeding. Now that has become reality. We were talking of ORS. Now that has become reality. I was talking about 20 years ago on adolescent care, or 30 years ago on adolescent care. And now that it has become the national priority. I think the next thing that we need to attack, I would say attack, something which is very close to my heart, that is preconception counseling. I've been doing it for more than 25 years now. Only thing is, that was small bits and pieces effort. I'm going to focus only the medical part of it, not too much of sociological and other reason, because there are many others who can do that. So let's see what it is. The pre-conception counseling, what is the goal of that? One, to reduce the risk of adverse health effects to the woman, fetus, and neonate by addressing modifiable risk factors and by providing education about healthy pregnancy. We all talk about the inadequacy of our young girls to understand some of these issues. Either they take it, okay, this is natural, all of us have got pregnant, what's so great about it? One approach like that. On the other side, they are all highly educated people. What do you need to teach them? But 40, so many years of counseling, 41 years of counseling has taught me that education and knowledge on your health need not go together. In fact, the most uneducated may have a better concept. Not very scientific, but at least by the traditional one. First point I would say is pediatricians need to educate the would-be parents. That is a huge investment for preventing problems. Now, when I said it long ago, that was 30 years ago, there was no listener. And then there was a meeting in Delhi, WHO, UNICEF, everybody together. And WHO CRO chief at that time, Delhi, she basically, from a nursing background, she is a director. She made a presentation on WHO's vision about pre-conception care. So I congratulated and said, now that you have put your stamp, it will become an official subject. I have been shouting about it, nobody to listen. But now that WHO has taken it. So what has WHO said is, they are talking about during adolescence and before pregnancy, we have a huge role. The pregnancy time, we have some role. Birth time, we have a lot of role. And pregnancy time, the role we are talking about is, especially if you are going to be a neonatologist, the high-risk pregnancy clinic is your priority. You need to help the obstetrician to come out with some of those decisions. That is very important. Birth time, of course, it is established that neonatologist is there. Postpartum period, lot of postpartum psychosis, which is something which is not known at all. There's a lot of, not extreme psychosis, but a lot of psychological problems where the newborn is not able to get. And then, of course, maternal health, infancy, childhood. WHO has addressed the pre-conception care package. Remember, when you look at this package, it may look like including everything. That is because they are, WHO, when you do something, they are thinking of the dark Africa. Medical care is very poor. Is still some of the issue. Nutrition is a huge issue. Mosquitoes are a huge issue. Malaria is a issue. Genital mutilation, environmental health, sexually transmitted infections, tobacco, substance abuse, whole lot of issues they are talking about. I don't think we need to focus on so many areas. We will try to focus on few selected ones. But before that, let us say, why invest in pre-conception care? Prepare the would-be mother to help prevent unintended pregnancy. That is very important. Every pregnancy has to be intended. We should reduce preterm low birth weight. We need to reduce the birth defect. Much more important is IUGR, intrauterine infections, HIV, and STI. Because even in Kerala, even now, the low birth weight rate has not come down beyond 20. Okay, from 30 is the average India. We have 18 to 20 Kerala. So that IUGR is a huge problem we need to address. In fact, this is my Doctor of Science was for following up these IUGR babies at 1 year, 2 year, 10, 13, 16, 19, 24. And now Dr. Deepa Bhaskaran is doing the PhD for trying to do what happens to them at 34 years. Okay, so intrauterine infection has long-term implications, and that is something very important. Then, of course, 3 words always we must talk, even middle of the night. If a baby has a developmental problem, it has only 3 reasons, not the 4th one: hypoxia, hypoglycemia, septic shock. Either there is no glucose there, no oxygen there, or no enough blood not going into the brain. The rest are unimportant compared to these 3 things. And if we can prevent this, then of course we can save. And what do you do for that? You need to understand. I just give one example. Now, if you have an adolescent girl with PCOS, polycystic ovary, this thing, you know for sure that she is going to be a candidate for gestational diabetes. Actually, the present head of gynecology in SETI, Sri Umari, has done the MPhil with me, shown that 11 times more chance for insulin resistance if you have PCOS. 11 times more chance. Or if you have insulin resistance, there is 11 times more chance to be. That is a linkage I am talking about. PCOD is something we pick up in the adolescent age, but then onwards, you know, what are the problems you are going to have? Infertility. Now, just think of your daughter. You know, you got her education, you gave her so much of gold, you got her married to this thing. She is going to have infertility. If after all the effort she gets fertile, then she is going to have gestational diabetes. If you take care of all that, the baby's problem, or later on she is going to be a classic diabetes and all the other problem. So I think preconceptional care is important, particularly from the point of view of hypoglycemia. And then, of course, infection. We all neonatologists know that the maternal genital environment is the precursor for all infections, for premature rupture of membrane, amnionitis, the whole lot of problem that we are talking about. We need to keep that part clean. And has become an obsession for the girls. If you look at the YouTube now, almost every program is how to keep your that part not becoming dark and dirty and all that. Okay, there's an obsession. Let it be. Let that obsession be in the early pre-adolescent itself. Say that your genital hygiene is so important that tomorrow you won't have this. That may be their priority, but our priority is not to have genital infection leading on to low birth weight. Now, I won't read all this, but the government of India has done enough and more intervention in National Health Mission. So many karyakram, including newborn care, institutional delivery, NICUs, all sort of things they have come out with, JSSK program, RBSK for disability, and now, of course, adolescent programs through ICDS as well as RKSK. So the government of India has done their might and whatever is possible. Of course, nothing can be perfect in a government system, that we know, because they have to cater to the all population. But as a pediatric group, we can carve out certain academic areas where we can give input that will help the government program tomorrow. Now let's start from the original story, 2004, when I was a national president. That is the first time the executive committee of IAP has decided that we are committed to look after you till you are 18. And it's a module prepared by myself and Dr. Kamath at that time. I remember 1909, Dr. Jacob John actually lighted the lamp for the first adolescent conference. Then we had 1 or 2 conferences in Delhi. Dr. Swati Bhave had done IPCA, International Training Program, and so many. Now AHA has become a big issue. Now, what are the things that 10 commandments for preconception counseling? I think if you need, you can take a screenshot of this. This is all what you need to know. What I'm going to say after this, it's only justification, and I'm sure all of you know this. You may even be able to speak better than me. Number one is adolescents need family life and life skill education. It's very important because the problem with present day children is they are educated, but they don't have the life skill or the knowledge on simple things. There is one group of girls who talk about, putting finger inside and whatnot. But on the other side, that you have a whole lot of girls feeling shy to say that I have menses. Difficult to say, I want to go to toilet. Can you imagine, such girls even now, there are plenty who doesn't want to, you sit tight because you can't tell the teacher, I want to go to toilet. So both extremes are there. Then you have immunization, rubella, hepatitis B, and HPV. And I think it is time we start pushing HPV a little more. Because now we say it's not a sexual vaccine or something. It is just an adolescent vaccine at 12 or 13. And I think pediatricians need to do. Hepatitis B, all of us know. Rubella, we fought. Now it is free, but then people are not taking it. Then preconceptional folic acid intake. I think every pediatrician should know that, your neural plate develop like this, and by 24 days it fold like this. Okay. And if you don't want a hole in there, then you need the coenzyme folic acid. We all obstetrician give folic acid after you have become pregnant. Remember, pregnancy occurs between 2 menses. So that means 14th day, around 14th day. So 2 weeks plus 1 week you wait for before you say that you have a delayed menses. So 21 days. Then another 2-3 days by the time you tease the doctor. Not a single girl reaches the doctor before the baby or fetus is 21 or 24 days old. And by then the neural tube has folded. So if there is an opening, it is. I'm telling you, it's a tremendous state of my own one relative had this problem. I pushed folic acid because her marriage was fixed in 1 week. So I pushed folic acid 5 or 6 days she could take. Then maybe she got pregnant on the first day itself. 14th week, 12 week ultrasound was okay. Everybody was happy about it. But I insisted on a detailed anomaly scan, and surely she had spina bifida. And abortion had to be done. So you can imagine a young girl, abortion done, naturally she goes into depression and whatnot. So I think we need to insist that it is our responsibility and not obstetrician responsibility to push this idea. Then there's body image concern. And you talk about polycystic ovary from that point of view. Body image concern, but your inside is for medical reason, dental care, very, very important. All the infection related to pregnancy, related to cardiovascular, everything, the root cause is dental care. So I think that is we need to. Then a medical checkup before marriage, medical checkup, breast examination. Gynec exam doesn't mean pervaginal examination, just a normal adolescent pediatrician lady or a gynecologist need to ask about menstrual problems. We'll come to details. But together, everything I'll summarize, do an ultrasound abdomen that will take care of 95% of problem. Your kidney is normal, liver is normal, uterus is normal, your cervix is normal. You're a normal girl, go ahead. And breast, of course, most important, I'll come back to it. Very important to remember is do not unnecessarily expose a virgin breast to all sort of investigations. You don't need to. Only an ultrasound is required. I'll talk about later. Then screening for menstrual problems, PCOS, and genitourinary infections. Just now, actually, the chief of infertility, Dr. Sheila Balakrishnan, is present, has already submitted a thesis to Kerala University. She was working with me on polycystic ovary, and it will another 1 or 2 months she will be given that. Another professor has just completed work on genitourinary infections in adolescents. Huge data sets are coming. So I think we need to take note of this. As pediatricians, we need to take. Then screening for anxiety, depression, and suicidal ideation. Now remember, we have already published from ALAPI data saying that how much 23% of random picked up 500 adolescents do have what you call anxiety disorder, and 1/4 of them have depression. So it is already there in the community. On top of it, now COVID has come and COVID has made it huge. Up to 40% they are giving data. So a study of 18 studies together done in India has come out with alarming data on that. Forget about exact percentage. It's a huge number. Then sexuality skills, understanding needs and of self and partner. Unfortunately, anybody who talk about sexuality become a bad person. I am jealous of Krishna because I am very, very jealous of him. I wish God had given me a face like him, so innocent looking, so that he can talk sexuality and nobody will feel anything. Unfortunately, I have a face, even before I open my mouth, they will think that he is talking rubbish. You get the point. I wanted that innocent looking face so that we can talk about. The maximum counseling I do is premarital and newlywed. And one of the problems, most of the problems that we see is related to sexuality. Just now I have given this link to a girl who is just married for 1 month, because today morning she told me, sir, I am in trouble. Nothing this thing. I said, Beta, you listen to this. You listen to my talk. I have given the link to her, so that let her listen to all this few times. She also become comfortable. Newlywed counseling for both partners, particularly important, the urinary infection. We used to call honeymoon cystitis. It is called honeymoon urethritis. Then there's a new area coming in, self-counseling to develop. I'm working on that. A huge article will be coming on self-counseling. Now, family life education, I don't want to talk to pediatricians all this. We talk about nutrition, personal hygiene, scholastic, life skill education, emerging adolescent sexuality, risk-taking behavior, and some amount of supportive counseling. And we have talked about this so many years. Now, this is our IAP health card, where you have on one side, you have height, on the other side, you have weight, and both join. Suppose you take 160, line goes up like this, join from here, 160. If it is 60 kilogram, it is going to be obesity. If it is 40 kilogram or 35 kilogram, it's going to be undernutrition. So it is something with school, we can do it. Then this information is so important that the pre-pubertal nutrition, pediatricians have to now start talking about it. We all talk about adolescent nutrition, but remember, once the menses has come, whatever nutrition you give, it only increases the breadth of the child, girl, not the height. Remember, height increase is so little. The growth spurt occurs maximum 2 years before the onset of menses. After menses, growth spurt is not there for girls. So that means the age at which we do not talk about nutrition, that is a primary school child, it should be the next focus. And how do you know when she is going to have the menses? The moment breast bud comes, within 2 years, the child is going to have menses. So that 2 or 3 years, bombard with any amount of feed. Don't bother about obesity. She will never get obesity. She'll become a tall girl. Why you want a girl to be tall? Because out of all the single most factor determining low birth weight, Hervey et al., they have followed 50,000 pregnancy in Pune study, which they showed many things. Number one is height of the mother. Number two is anemia. Number three, where they have actually said attributable risk, 25%, 26% of can be reduced by height. But nothing can be done for height now. The anemia, antenatal care. But Kerala anemia and all that is little more or less. So what is important is, the present that girl, we can't do anything, but the younger child of that girl in front of you, you can do, because you can give nutrition advice. Then, of course, this is the adolescent self-risk assessment. We never ask them, do you have this? Do you have this? They get insulted. So you just give a questionnaire like this, but I just tick it, which one? Do you have sedentary habits, fat intake, calorie? I won't read all this. I will only say one thing. We were unduly blaming the fat too much. Now the nutritionists believe that it is not the fat, it is a calorie that is creating problem. Empty calorie. That's why from junk food we have come to junk, G-U-N-C. The whole lot of nutrition thing has come. Too much of carbohydrate. Fat is not all that bad as we believe. Then of course, reduce the salt, reduce the fat, reduce the plain glucose or the soft glucose or food. So that's the most important thing. Then of course, we will talk about adolescent pilot program. 99, we had the first family life education module. 99, we have the teenage screening questionnaire. 2000, you had the first adolescent clinic in India. It is still there in Pangapara. Some population council, 2 ladies had come to visit. And the first teen club at Kodapanakunna in 2000. You can see some of these people who have been seeing this. Okay. And this is a dental checkup by the professor there. Now let's get quickly into immunization. Why you are bothered about rubella syndrome? Because rubella is a simple disease. All of us know. If a girl in the school has it, let everybody hug each other. Let everybody get it. Nothing wrong. But the moment if you are pregnant, in fact, SAT, we had 28 cases of congenital rubella syndrome coming as a wave. And that's the time really PGs got shocked that it is such a bad disease. I'm talking about 15 years, 12 years ago, where we had a whole lot of 28 cases of congenital rubella syndrome. Cataract is a major issue. Deafness is a major issue. Heart defect is a major issue. If you ask what is the single most important cause for preventable cause of deafness, it is still rubella. Then, of course, hepatitis B, we know that even if you burn, it will give problem. That is important. The human papilloma virus, we were not pushing it too much because of the cause. But I suppose in spite of the cause, we are giving 101 pavan and all that. This won't cost even a quarter pavan. So why not we actually give this immunization? Pediatricians have to, IAP has to take it up as a big program to protect our girl child from the cervical cancer. That is important. Then, of course, this is what I said about preconception folic acid. At that, my thesis was congenital anomalies in newborn. And at that time, I had the highest anencephaly I'm talking about 77, 79. Simultaneously, IC Burma from All India Institute also reported the highest from Punjab population. Okay. Then, of course, toxoplasmosis. We know that toxoplasma is the biggest problem. Our young girls have a habit of eating dirty meat from outside. They eat, so long as any junk, filth is filled between two bun and put some leaves and all thing, you happily eat, paying 100 rupees, 200 rupees. But what sort of meat goes into it, we don't know. It is not cooked meat. It is that uncooked meat that is giving you toxoplasma look at the center, in the muscle, and that will give you problem when you are pregnant. Then, of course, acne and dandruff, the issues. Why you should know about acne and dandruff is because if you want to attack, if you want to impress the girls, they won't get impressed by all your high talk. They'll get impressed if you remove the what you call their pimples. And why pimple? Most often because unnecessarily using the what you call makeup. And even if you don't need makeup, even if you use it, use cleansing fluid and remove it. Cleansing fluid or even simple oil, remove it. That is the most important. Nisra, this is dandruff. We know there is some amount of fungus in it, some amount of emotional feeling also. This is very important. The greatest dermatologist in Trivandrum before he died, last thing he taught me was that Harindranath sir, we were actually planning to write a book on pediatric dermatology. And one of the things he said is, you take any dandruff, there will be an element of fungus on one side and emotional stress on the other side. So treat both. That is the thing. Dental care, of course, bad breath is one of the biggest problem because you get a girl married, third day she come back, and laughingly we say it is bad breath, but there are a lot of bad breath, other bad breath. You have a whole lot of hair growth. Almost a good percentage of girls now walk around with obesity and unnecessary hair growth. All sort of methods are there to remove it. Laser is probably the best. Forget about it. That is their business. But our business is to see whether there is underlying PCOS. Remember that 40% one obese parent, 40% with one obese parent become obese, 70% with two obese parents become obese. Why do you have to wait for things to happen? Why can't we start doing intervention earlier? Then, of course, this is some information normally not given in any book. One of the problems, if you are a counselor, one of the things the most girls will come to you, they will say, I'm thin. Okay, they will come and say, I'm thin. Just look at them like this. Then I just show thin. Just sir, yes. You don't have to say. Actually, they don't have breasts, or they have breasts. They think that it is too small. Okay. On other side, even if it's small, some people think it is too big. So what you need to understand, if you divide the breasts into 4 quadrants, okay, never you have, very rare, all 4 quadrants are well developed. Most Malayali girls have the upper 2 quadrants so filled so that they have to put a button like this, otherwise it is seen outside. Whereas you see a North Indian girls, it is a lower quadrant so well developed. So they will open up 3 things and walk around, nothing will happen. So that is something. Some people have middle one completely atrophied. Some have side ones atrophied, all sort of things. So I think we need to have some understanding. In fact, my book on premarital counseling, the first 2 books I am coming out, and one is, this is just the print, before the print copy, premarital counseling. There is another book coming on adolescent gynecology along with Dr. Sheila Balakrishnan. These are 2 immediate books that is going to come, in which very clearly these things are told. Pediatricians should not feel shy away. We are all at that age where our daughters are grown up, our children have this problem. Look into the eyes of the child, see the reflection of your own daughter. Just talk whatever you want, it will be correct, no problem. And rarely you have a situation of juvenile breast hypertrophy. At least I remember 3 girls, I have got plastic surgery done, reduce the size to 1/3 or 1/4, and that will make life easy for the girls. Then this is a very serious business. Preconception care for epilepsy. Umpteen number of papers I have published with actually along with Dr. What is his name? Forgetting. The professor of head of neurology in Chitra. Now he has become the director of ICONS. Okay, just last month we published a paper on that. Remember, what is important is all anti-epileptic drugs are not same. Select the safest anti-epileptic drug. In general, valproate is to be avoided. Every IMA meeting you talk. For a mother who is going to get married or become pregnant, do not use valproate because that is the most dangerous. We have enough data on that. Generalized epilepsy, newer anti-epileptic drugs like lamotrigine and levetiracetam, etc., carry lesser risk of fetal malformation and neurocognitive impairment. Okay, this has been published. Has been published. Just 1 or 2 months ago, we published the whole lot of review on that. Focal epilepsy, sodium channel blockers such as carbamazepine and oxycarbamazepine, etc., are preferred. So what you are saying is, if when you are getting married, if you are on anti-epileptic drug, do not stop the drug. That's what children will do. That will produce, status and get into trouble. But try to reduce the dangerous drug, remove the dangerous drug. This actually courtesy from Sheila Namburi is a confidential information. But I am not going to read all this. But what she is saying is, is an extremely good slide which says that consanguinity can be, what do the people come to you for? If you have recurrent miscarriage, balanced translocation, abnormal first trimester screen, Down syndrome in previous pregnancy, metabolic disorder in the previous child, the number is small, but in a teaching hospital, I think Mohandas should take care of this part, because Calicut has so much of population who needs genetic support. So you can think about it. This will come in an article. In the book, Sheila has written this. It's coming with as a book. I just taken one thing with her permission. Okay. What I'm saying is, though this is not a large number, we need to think of prenatal counseling. One information I would tell you that in one thing we learned is in Israel, where they have so much of metabolic diseases because cross-feeding, they have a system that when you are born, your blood is taken and put in the repository. When you want to get married, you are given a unique number. You put your number of the boy whom you want to marry, they will give you a clean sheet. Go ahead and get married. But if they think that there is a problem of a thing, they will call you for counseling. They won't say don't get married, but then they will say you have a such and such risk for such TSAC or what diseases. So you have to do prenatal diagnosis. That is a beautiful system in there. This is what I was telling in breast examination. We all have a old fashioned that the moment there is a swelling, I'm telling you, people are using mammogram. It is not meant for 18, 20-year-old girls to do mammogram. You only have to do an ultrasound. And there is a radiologist trained in Canada. She's in Amrita. She's only doing ultrasound breast. And she guarantees for 99.99999% guarantee that a breast below 24 cannot be malignant. The chance is as good as some snake come and bite my leg and I die. That can happen, but it's so rare. So let's not do unnecessary biopsy. You only do an ultrasound of the thing. And this is very common. You have before the menses, you have a lot of swelling, pain, all that. But it's discomfort only. It doesn't give any fibrosis disease of breast. That is important. Then, of course, you have the 7-question screen. Okay, I won't spend too much time on that. How frequent is your menstrual period? It has to be 21 to 38 to 35 days, because 28 plus or minus 1. You have what are the abdominal pain, nausea, vomiting. You have premenstrual syndrome. That is, pediatricians should know about premenstrual syndrome. In fact, much more than that, premenstrual dysphoria, that whole lot of thing, where you actually may have to treat with the fluoxetine, which we use for anxiety and depression. There are quite a few of girls who may need this. Unfortunately, no parent ever bother about the struggle they go through during the menses. I think we need to understand that many of these girls are miserable because they have so much of premenstrual syndrome, and that has to be. Then, of course, itching in the groin and vulva, whether you are discharged. White discharge is usually, normally pearly white. It can become curdy white, and we have enough data to show that 20% of girls in the community will have abnormal discharge and 20% will have malodor. And if you do swab, which has been published, that about 12% will have proved candida. So most of the time it's only, unless you are sexually active, none of the adult diseases are there for the small girls. See, this is the data I'm talking about. This is the first study in India on unmarried. And now after the PhD, we are going to get results of 4,000 girls in the community, where we have done the swab, external swab, to show 21% itching, 19% malodor, and 11.7, 12% have candidiasis. Okay. Then, of course, good personal hygiene. Unfortunately, all sort of nonsense come in the YouTube, that about shaving, removing the hair, all sort of chemicals put there. None of this are there. You only need to trim. The moment you shave, what happens is like fathers shave like this. If you shave like this, you get all those sort of things. because the oil under the hair is protective. You don't have to do that. Before the menses, trim as much as you want. By the time next menses come, it will grow. That is all. And there is also now we are saying, trying to say that soap is not good and all. It's all commercial trick. They only talk about pH, but won't say whether pH increase or decrease. Only play with the word pH. It is not there. Such products are for post-menopausal women, not for young girls. Young girls have an alkaline pH for 3 to 4 days during menses. That if God has given it that way, there is a purpose behind it. If he can think of making such a perfect being, and he won't make a mistake in there. So why unnecessarily? Soap, the usual soap, before night going to sleep, squat down, clean well, wipe well, and your problem will not be there. Then, of course, ultrasound. This is a huge study of 3,400 plus 2 girls, where 28% said irregular menses, 13% had menses problem, out of which 75% had a PCO in there. The latest that we have found after her PhD is ultrasound is not required at all. We have done for 4,000 girls ultrasound, blood count, blood exam, everything has been done. The final result is if you have irregular menses, absent menses, if you have increased hair growth, you have PCOS and that need treatment. And the treatment is, number 1 treatment is weight reduction, number 2 is weight reduction, number 3 is weight reduction. If you don't have a menses for 3 months continuously, you need to give hormone therapy to make sure that forcefully you bleed. If you don't do that, your inner lining of the uterus becomes so thickened that tomorrow you won't get pregnant. So make sure, every mother make sure that at least once in 3 or 4 months, the child should bleed. I have a patient now who didn't have bleeding for months and months and months. He said, oh, so happy, don't bother. But now when she's trying to get pregnant, every gynecologist is saying that endometrium is so thickened that you cannot have implantation. Okay. Then, of course, PCO, so many reasons, but most important is irregular menses, increased hair growth, and diabetes, hyperinsulinemia. These are the 3 things that is given problem. Finding, you can see, just take the abdominal circumference. It will tell you, don't have to go to see horoscope. They take your abdominal circumference, you know how long you are going to live. Look at the neck, acanthosis nigricans, look at the hair growth and cysts in the thing. Okay, extreme form of hair growth. And this is a Ferryman-Galway where you, 13, 14 places, you look at the hair growth. I won't go into detail of it. What we normally do is show the girl the picture and say, where all do you have? So they become very comfortable. And sideburn is of my contribution. Now, Ferryman also has agreed sideburn as an important criteria. This is actually Srimari's, what I said, 11 times more odds for developing insulin resistance if you have PCOS. Okay, exercise, exercise, exercise. And this is one slide you should know, that if you give placebo, the cumulative incidence of diabetes goes at 45 angle, 45 exactly. If you do metformin, it comes down. But if you do lifestyle, it comes even down. So metformin is not the answer. Lifestyle is changes are the answer. That's most important. Then, of course, there is a problem of endometriosis. I won't go into that. Then we need to, pediatrician should know if the girl did have menses before 9 or doesn't have by 15 and they reach to adolescent pediatrician, you need to do the checkup, see whether the girl, just show the picture. You don't have to even examine the girl. If the breast has to be 4 or 5, genitalia has to be 4 or 5 grade. If it is not, if it is, then you can wait for a little time, one more time, get an ultrasound done, make sure you don't have a problem and everything will be okay. And this is one slide I think you should teach the girls. You have actually the clitoris above, you have the urethra, the small vaginal opening, labia, etc. On the left side, if you look at the urethra is seen, but the hymen is closed. So naturally, she won't have external bleeding. But on the left side, see, the hymen opening is so small that first 1 or 2 days she may have bleeding, but after that clot forms, so it will be leaking for weeks together. I think that is important. We need to tell them. The children should have an idea what your hymen look like. This is extremely important. Then of course, boys, they have, most of the time I tell boys, they only want to know about one thing, masturbation only. So most of the time we don't talk much about it. Whatever you are doing, continue to do it. Your chest won't become inside, your hearing won't go, nothing will happen. Just reassure them what you are doing is okay. Only thing is you only have one and you need to last whole life. So better just don't overdo it. So one of the message I always give is, do you keep record of how many times did you go to pass urine? Similarly, don't bother about it. You feel like doing something, do it, finish it off. But how to introduce this word? Because our society, Malayali society, is very, very bad. On one side, you can do the dirtiest thing with even little children. On the other side, if you talk about menses, you are projected as such a bad fellow, such a dichotomous thing. So what we do is, I don't call masturbation as normal. I found out a word, not abnormal. Not abnormal means, if I say no, abnormal, the medical person will kill me. If I say normal, some religious people may say, oh, that is bad. You can't say like that. So say not abnormal. And the way to introduce that is by introducing priapism. In case of, particularly in Kozhikode, sickle cell anemia, children can have permanent erection priapism. You start with that topic to bring the idea of masturbation rather than straight away getting into it. Okay. Then of course we need to tell the girls, if you have unwanted premarital pregnancy, sexual activity, you are likely to get chlamydia, which is the biggest cause for infertility, or you have herpes infection, or you have HIV, all three. Now, this is a study actually including from Kozhikode. One of the district was Kozhikode, 4,200 children, where we did UNFPA study, where we found that 10% of girls and 5% of boys had abuse. And the only way to prevent that is you make them take the oath. Give them that I am the custodian of my mind, body, and spirit. I will protect, preserve, and enhance it. Give them the capacity. Take them that my mind and body is not filth. Anybody can't go over it. It is my body. It is my mind. It is my spirit. I give that feeling to the child that to protect herself. That is important. Medical abortion, of course, we should not encourage emergency contraceptives to be used as routine contraceptive. Now, this is an important study. Sheila Mani was a professor of gynecology who did PhD with me. And what she found is that when you have a teenage pregnancy, we think the girl is bad. The girl is not bad. 3 reasons. Number 1, lack of parental control. You have 9 times more chance, to become teenage pregnant. If you have a poor husband-wife, father-mother relationship, 7 times more. And if you do not give age-appropriate sexual reproductive knowledge, 5 times more. 975. Remember, this is the most reliable data ever produced in India on teenage pregnancy. It is there. It's a thesis in 2008, the day she retired. So that means we need to go to schools. We need to tell them, give them the confidence that to say, I am a virgin, be proud I am a virgin. And that is what we need to tell the children. Okay. That is important. Then, of course, you have the mental health. I won't read all this, but I'll only say 3 things. All of us feel stress, angry, irritable, and all that. When does it become bad? First, if it is out of proportion to cause. Number 2, it has associated body symptoms. Number 3, the body symptoms become so severe that you can't do your work. 3 things. And if it is depression, 3 things. There is a worthlessness, hopelessness, helplessness. There is no, I am good for nothing, worthlessness. There is no future for me, hopelessness. I can't do anything in life, helplessness. then you shift into a place where you call life is not worth living, so suicidal tendencies. Then this same thing I said. Okay, I won't go into all this. This I have said it. Now, some tips on adolescent counseling. The steps are very important. You need to have a positive relationship building. You must give a lot of time for the child to ventilate. There may be 100 problems, prioritize into 3, and then prioritize which is the first out of them. You make the child understand what is your role in creating the problem. Most often we think the other person's problem. What is your role in creating the problem? Then what is the context? Your context. A poor child, your home servants, maid's daughter and your daughter say context is not same. You can afford so many things, she can't. So that context is important. Solution also, it has to come from the client, but out of which you help them to decide which is the best solution, implement it and terminate the counseling. Drugs, this has been published information. You only need to know about 2 drugs. Depression, fluoxetine. Anxiety, fluoxetine. Whole anxiety group, 20 to 40 milligram in the breakfast. Depression, 10 to 20 milligram in the breakfast. Of course, acetylopram, so many drugs are there. That, of course, psychiatrists will use so many. You only need to know one drug. The fluoxetine do not precipitate suicide. Remember that when you give a drug, the psychomotor retardation improves, but the mood change take long time. So in between period, there's a chance for increased suicide, but that is nothing to do with the drug. Second, of course, psychosis, the whole lot of group risperidone. If you know these 2 drugs, mania, for heaven's sake, don't try to treat it, give to psychiatrists. Mania and all, bipolar, we should not try to. We only need to treat anxiety, depression, and early psychosis after consulting a psychiatrist. Once he has confirmed it, then you can continue to do the medication. Okay? And repeating the same thing, the 10 commandments, and that's all. Thank you. Thank you very much.
Thank you, MKC sir, for introducing the new concept and also elaborating in detail how to go with it. And I think the IAP Kozhikode can take the initiative to prepare a module and start the preconception counseling program. Now the topic is open for discussion.
In fact, I had contacted the IAP Women's Wing person, IMA Women's Wing person. It's the ladies who should talk this, more than men. It's okay. More than men, it's a women's wing who should take up all this because they are the one who more in touch. The girls will be more comfortable with them.
Okay. Okay.
Can I make a comment? So,
Yes, sir. Yes, sir.
Thank you, Casey, for an
You are the
excellent
senior
talk.
most doyen. You have to say, you are the doyen.
An excellent talk and insight into various aspects of preconceptional health. It's extremely important. This is nothing but prevention of unwanted pregnancies, prevention of congenital malformation, the whole lot of prevention of disabilities in the community. I think we feel sorry, still our birth weight is not increasing. Our anemia is not decreasing. And all the morbidities which we come across is always remaining static. I think MKC must be remembering when we started newborn service, 30% were IUDR. And those 30% who survived are now living with all these non-communicable diseases. That must be the reason for large number of persons with diabetes, coronary artery disease, and such things. And I think this is a very important talk. Not only the talk, an important concept which we must pursue as pediatricians into the community. Don't limit our age to 18 years. I think there is no limit for 18 years. We should continue to serve the children we have brought up, we have treated, we have nurtured for long. I think excellent job.
Thank you, sir. Anybody wants to? I think the Dr. Vijayakumar is there. Vijayakumar, you want to add anything on the height of prepubertal children?
Yeah.
Krishnamasa, Dr. Anandagesh, right?
Another okay.
Yeah. Sir, Amkesh sir, how much thank you for the wonderful talks as you shared. How much we are stressing it in our education system? Including,
About?
in education system, our Padana Padadi.
Emphasis on which aspect you are talking?
Adolescent sex and all these things. How much I think it is not much projected in a healthy way.
No, sir. We can't say not projected. I remember the first module was written 30 years ago for DHS. I remember that even now I have a copy of that, a red book with 3 children's picture like this. I wrote the whole module. That time, of course, I was talking about family life education, everything under family life education. And then what happened when the book got published by DHS, except one page, everything else became Dr. C under the name of Dr. C.R. Soman. Okay, I remember that. So DHS was very upset. I said, no, sir, it's a God's will, because there are 2 advantages. Soman sir's name at that time was, the number 1, topmost. If he has written this, the acceptance will be high. Secondly, there is another advantage. Now that he sees his name, he cannot oppose it. Simple as that. So from that time, the class 9, we are doing it. Umpteen number of actually thousands and thousands of children we have children we have gone through this across the country. Now Sauhada Club for Adolescents, all these are happening. Let's not say things are not happening. Lots of things are happening. ICDS, every girl who is a boy or girl who was a beneficiary of ICDS, now they are taking care of them in the adolescent group. It's not that it's not there, but to create respectability, just like we all were promoting breastfeeding, but people used to look at this fellow, what is wrong with him? Every time he talk only about breastfeeding. Some of us got such contemptuous look because we are promoting breastfeeding. But now the UNICEF banner came in, suddenly it has become the most, respectful thing. This is what I want IAP to do. When the IAP stamp with some UNICEF or NH stamp comes, then the whole thing becomes so respectable, and ladies should come in front. I cannot keep on making bad name for myself. All my life I have made it. I don't care. I don't care. I don't care. So long as I believe it is correct thing, I will go for it. Even at this age, I don't care. I'm still doing that. But then that acceptability will not come completely unless every pediatrician start talking about it. What you are talking about I think he is not there, Vijay Umar. This proposal I had given to Government of India last year, before the Planning Commission, when the Planning Board I had presented in Delhi that the primary school children should be our focus. Because if you want growth, instead of 14, 15 years, now our girls are getting menses 8, 9, 10, 11. Where do they have chance to grow? You get the message. We don't give them a time to grow. Before that, they already have menses. So I think primary class 1, 6, 7, 8, 9. These are the 4 classes that we should be focused in nutrition. That is a quantum jump. IAP has to do it. You talk to Elizabeth and get UNICEF to support the idea. Are you with me? Not adolescent girls alone now. Because you feed adolescent girl, they'll become more thick. That's all. The height growth spurt has to be utilized, and for that, the endocrinologist has to come into picture. They should say, this is a growth spurt normally. This is what if you give extra nutrition, this is how your growth spurt will go. Poor child, let it be a child. My grandchild is 6-year-old. I am scared. She doesn't eat well. She doesn't, do. Now, another 3 years, she may have menses. Where do I get a chance to get her, to make her tall? So I think It is there, but we need to do little more on that.
Can I make a comment?
Yeah, please, sir.
So, thank you, MK sir, for that excellent talk. One thing is we are talking about this preconceptional folic acid and all for years together. But we, as very small percentage are, we could make them use it. Because most of the time, as you have mentioned, it is only after becoming pregnant they consult and it is too late. So why can't we have advise the government to have a chapter on all these things in 10th standard or so, so that all will be aware of this intervention. Some inputs about preconceptional advices and all. Because almost all of our girls become pregnant. So it is all universal and it is all of them should know about all these things.
Absolutely, sir. Absolutely. It is there now, slowly. You see, we only need to take a class for the teachers, convince them. And when you take class, don't talk about their students. You should ask personal question, Madam, make it very personal. You girl, she is going to have menses quickly. Are you giving extra food for her? Okay, become more specific on her own child, not about the whole school children. And then she get convinced, then you say, and for example, in pre-med, I do have so much of the only thing even as a vice chancellor, only extra thing I did was premarital counseling. And there what I do is even give a slip to say that urine albumin sugar deposit with the name. I said, keep it in your purse, nowhere else. But after marriage, within 2 to 3 weeks, you are likely to have a urinary infection. Don't feel shy to go and ask anybody. Just take some urine, do a testing. If the puzzles are more 6, just call me. I will give you the medicine on the phone.
Actually, sir, we have programs for under 5 children. We have programs for adolescents. But usually, primary school children, that 5
never a program.
We are not usually given the due attention. So what I feel
from
is,
Calicut, sir. Let us start from Calicut. Yeah.
So what I feel is, as sir said, you cannot separate childhood into different parts. So you should concentrate on entire childhood, nutrition, immunization, healthy childhood. So that is the one thing which I got from the talk. So
sir, if you give thesis on growth of this primary school children, focus some few thesis work on their growth, their development, their psychological issues, this thing. Suddenly there will be a rush on that primary school, which is most, of course, new national education policy. It is no more primary. Class 1 and 2 is going into pre-primary. So even if you focus on class 3 and 4, that will be some thesis work. The PGs will come out with excellent data. And then say you do intervention 2 years and what happens to their height later. Those who have had intervention, those who did not have intervention.
So there is a question in the chat box. How to counsel a pregnant mother who had close contact with the recent Nipah infection? Should we tell her the small risk of serious physical damage to baby?
I don't know. Actually, I'm not an expert on Nipah. Somebody from Calicut should answer. I don't know. I have no expertise.
The same question can be asked about Zika virus also. Recently, Trivandrum had a spurt of Zika virus infection.
Yeah. Zika is definitely dangerous. Definitely. No doubt about it. Even if the chance is less, you should take that. You have 100% chance. Zika, it affects the brain. No doubt about it. So Zika I can answer. Nipah, I don't know. Actually, what has been your experience in Calicut last Nipah? Did it have any problem on the fetus? I don't know.
Sir, can you comment on that?
About
Nipah, not this one, last time's epidemic, did it have any effect on the fetus or something? Any anecdotal report at least? I don't think I saw any.
Here it is only a contact with Nipah. That particular
Yes.
lady did not have any infection.
Yeah.
So I
That's
don't think she need to be worried about that. It
We
is
will
a-
know. We are yet to know more about the epidemiology, the spread, and other details of Nipah. We have to wait.
But Sikka, we know not only from Africa, Rajasthan had huge epidemic. So
Yes,
Sikka, we know it is,
Yes.
even if it is in your neighborhood, you start acting because that is so dangerous. No doubt about it.
Yes, absolutely.
Anybody wants to? Parvati Madam is there. Madam wants to comment on. Ajit, Dr. Ajit.
Thank you, sir, for the excellent talk. Really, sir, the student 1993-96.
അറിയാം മോഹൻ കാണിക്കേ
കാലത്തിന് മുന്നേ നടക്കുന്ന ചില വ്യക്തികളിൽ വളരെ കുറച്ച് വ്യക്തികളിൽ ഒരാളാണ് സാർ. സാറ് തുടക്കം എനിക്കറിയാം ബ്രസ്റ്റ് ഫീഡിങ്, പിന്നെ അത് കഴിഞ്ഞിട്ട് നിയോനേറ്റൽ കോർണേഴ്സ്, പിന്നെ ഡെവലപ്മെന്റ്, ഇപ്പൊ ഇതാ നമുക്ക് പ്രീ counseling, pre-conception.
I'm glad you remember that 81 I started neonatal corner in the labor room.
Sir, ഏത് ടച്ച് ചെയ്താലും I was thinking, അപ്പൊ സാറിന് ടോക്കുന്ന സമയത്ത് I was thinking back, like സാർ ഏത് ടച്ച് ചെയ്താലും it makes ഒരു മിഡാസ് ടച്ച് ഉണ്ട് സാറിന്. it becomes a program, നേരത്തെ മോഹൻദാസ് പറഞ്ഞ പോലെ. ഇത് സാറ് നമുക്ക് എന്തായാലും ഇത് we have to make it a great program which can be started. I think we can start IAP Calicut as well as Department of Pediatrics. And I think Vijay Kumar is going to be our next IAP president, and he can make it an action plan for pre-conception.
No, I didn't want to use the word premarital because for the doctors it may sound a little silly.
Yeah, pre-conception.
That's why you avoid the word public. We'll talk premarital. Yeah.
But basically pre-conception counseling. But either IAP state president's program, I think we can ask Vijay Kumar to include that. And as sir said, IAP can textbook include sir as Kohas vice chancellor ayirunallo. So sir adile nammaloppam undavanam. It has to come in textbooks. Yeah, because
it will come because already 1000-day program, Epic 1000 has given a big section on pre-conception. I always suggest that. So it is getting...
വേറൊരു സാറിന്റെ ഫേസ് ഇന്നസെന്റ് തന്നെയാണ്. സാർ അത് വിചാരിക്കേണ്ട ആവശ്യം, ഇന്നസെന്റ് തന്നെയാണ്. സാറിന് മാത്രമേ ഇങ്ങനെ സംസാരിക്കാൻ പറ്റില്ല, വേറെ ആർക്കും ഇങ്ങനെ സംസാരിക്കാൻ പറ്റില്ല. അതാണ് ഞാൻ കണ്ട ഒരു വേറൊരു പ്രത്യേകത. സാറിന് കറക്റ്റ് ആയിട്ട് ആ പോയിന്റില് കറക്റ്റ് ആയിട്ട് നല്ല വാക്ക് നേരത്തെ പറഞ്ഞില്ല. not what you call not a when you talk about masturbation, not a problem.
Not abnormal.
അത് മാത്രമേ അങ്ങനത്തെ വേർഡ്സ് ചൂസ് ചെയ്യാനുള്ള കഴിയും.
അതെന്താണെന്നറിയോ, ലീഗൽ ലാംഗ്വേജ് ആണ്. കോടതി പോയി ചോദിച്ചു, നീ നോർമൽ ആണെന്ന് പറഞ്ഞോന്ന് ചോദിച്ചു, ഏമാനെ ഞാൻ പറഞ്ഞില്ല. നീ അബ്നോർമൽ ആണോന്ന് പറഞ്ഞോ? ഇല്ല ഏമാനെ, ഞാൻ അതും പറഞ്ഞിട്ടില്ല. ഞാൻ ആകെ പറഞ്ഞത് നോട്ട് അബ്നോർമൽ.
So I think there are a lot of take-home messages from your talk, sir. And one of the messages I would like to take home is that you have to think beyond your time, beyond you, beyond your what you can do to the society. That's a great thing from Sarnde life. ഞാൻ നോക്കുമ്പോൾ ഉള്ള ഏറ്റവും പ്രധാനപ്പെട്ട കാര്യമാണ് you have to not be selfish. Sir, ഒരിക്കലും selfish അല്ല. അത് ഒരിക്കലും അത് and also to and the society ക്ക് വേണ്ടി എന്ത് വേണമെങ്കിലും ചെയ്യാൻ വേണ്ടിയിട്ട് if you one point which you said already, ഞാൻ കറക്റ്റ് ആണെങ്കിൽ അത് എവിടെ പോയി പറയാനുള്ള ധൈര്യം, അത് അത് ഏത് വലിയൊരാളെ പ്രസിഡന്റ് ആയാലും ഈവൻ നമ്മളെ US പ്രസിഡന്റ് ആയാലും സാർ അത് പറയും. പറയുന്ന നല്ല രീതിയിൽ പറയും ചെയ്യും. അപ്പൊ അതാണ് ഞാൻ എനിക്ക് സാറിന്റെ അടുത്ത് നിന്ന് കിട്ടിയ
അത് വർക്കൗട്ട് ചെയ്യുമെന്ന് 5 കൊല്ലത്തെ വൈസ് ചാൻസലർഷിപ്പ് ഞാൻ കാണിച്ചു. ഞാൻ ബഹുമാനപ്പെട്ട ഗവർണർ ഇരിക്കുമ്പം ബഹുമാനപ്പെട്ട മുഖ്യമന്ത്രി ഇരിക്കുമ്പോഴും പറയുന്ന ഒരു വാക്കുണ്ട്, ദൈവം തമ്പുരാൻ വന്ന് പറഞ്ഞാലും നിയമവിരുദ്ധമായിട്ടൊരെണ്ണം എൻ്റെ യൂണിവേഴ്സിറ്റി നടക്കത്തില്ല. അത് എല്ലാം അംഗീകരിച്ചിട്ടുണ്ട്. നിയമവിരുദ്ധമായിട്ട് ചെയ്യത്തില്ലെന്ന് പറഞ്ഞാൽ ചെയ്യത്തില്ല. ബിക്കോസ് അത് നോബഡി ഇൻ ദിസ് വേൾഡ് ക്യാൻ ടെൽ യു ടു ഡു ഇല്ലീഗൽ തിങ്. ആണെങ്കിൽ if you know you are 100% doing it correct, then nobody can question you. Nobody will question you. That's why 5 years I never had a problem. Nobody interfered at all.
അതൊക്കെയാണ് ഈ യങ്സ്റ്റേഴ്സിന്റെ പാഠം. സാറിന്റെ പാഠം എനിക്ക് തോന്നുന്നു ഈ ടോക്കനായിട്ട് കൂടുതൽ വലിയ പാഠങ്ങൾ അതാണെന്ന് തോന്നുന്നത്. അപ്പോ
ഹാഫ് ഹാർട്ടഡായി ചെയ്യാൻ പാടില്ല. അങ്ങനെ പറയുമ്പോ നമ്മൾ അതുപോലെ നിൽക്കണം. അതിന്റെ ഒരു തമാശ പറയാം. ഞാൻ അവിടെ താമസിച്ചപ്പോ ഇവിടുന്ന് വീട്ടിൽ കൊണ്ടുവന്ന് 2 ഉണക്ക ചപ്പാത്തിയും ബ്രെഡ് ആണ് കഴിക്കുന്നത്. അവിടെ കാര്യമില്ല, കുക്ക് ചെയ്യാനൊന്നുമില്ല, ഞാൻ ഒറ്റയ്ക്കാണ്. അപ്പൊ വൈകുന്നേരം ഒരു ഹോട്ടലിൽ വലിയ മീറ്റിംഗ് ഒക്കെ കഴിയുമ്പോ വാണം വിട്ടപോലെ ചാടി ഇറങ്ങും. വണ്ടി കയറുമ്പോ ഡ്രൈവർ ചോദിക്കും, ഓട്ടം കണ്ടാൽ തോന്നും അവിടെ എന്തോ ബിരിയാണി വെച്ചേക്കുന്നെന്ന്, ഉണക്ക ചപ്പാത്തി കഴിച്ചാൽ കൊള്ളാമെന്നുണ്ട്. പക്ഷെ ഞാൻ ഓടുന്ന എന്തുകൊണ്ടാന്ന് വെച്ചാൽ ആവശ്യമില്ലാത്ത കോണ്ടാക്ട് വേണ്ടെന്ന് വിചാരിച്ചാണ്. അത് ഇമ്പോർട്ടന്റ് ആണ്. നമ്മൾ പറയുമ്പോ അത് സ്റ്റിക്ക് ഓൺ ചെയ്യണം. ഹാഫ് ഹാർട്ടഡ്ലി ചെയ്യാൻ പാടില്ല. ലേഡീസ് ആരും ഇല്ലേ? ഐ തിങ്ക് വൺ ഓഫ് ദം ഷുഡ് കം ഫോർവേഡ്. ആരെങ്കിലും ഒരു ലേഡി മെമ്പർ ഷുഡ് കം ഫോർവേഡ്. അവര് വേണം ഇത് പറയാൻ.
ആരെങ്കിലും ഗീത, ഐ തിങ്ക് കൃഷ്ണമാർ ഗീതനെ വിളിക്കുന്നത്. ഗീത ഗോവിന്ദ.
സിന്ധു is there.
Sindhu is there. Geeta is there.
Other than ഗീത വേറെ ആരെങ്കിലും പറയട്ടെ. കൃഷ്ണകുമാർ പറയുന്ന ഗീത പറയുന്ന ഒന്ന് തന്നെ. ഹിസ് മാസ്റ്റേഴ്സ് വോയിസ് തന്നെ. അതാ
സിന്ധു is there.
വേറാണ് പറയട്ടെ. ഒരു വീട്ടിലുള്ളവർ 2 ഒരേ അഭിപ്രായക്കാരായിരിക്കും. വേറെ ആരെങ്കിലും ഇല്ലേ? ലേഡീസ് ആരും ഇല്ലേ? മോഹൻദാസ് എന്ന് വിളിക്കുക ആരെങ്കിലും. I want them to commit. Ladies ആരെങ്കിലും ഒന്ന് കമ്മിറ്റ് ചെയ്യാം. ഇതൊന്നര വീഡിയോ ഓൺ ചെയ്യൂ.
ഹിന്ദു വീഡിയോ ഓൺ.
ഹലോ ഹിന്ദു, പ്രിയ ഉണ്ടല്ലോ. ഗീത, റേഞ്ചില്ല.
ഓക്കെ, എന്നാ ഗീത മാഡം മതി, പോട്ടെ, നമ്മൾ അക്സെപ്റ്റ് ചെയ്യാം. ഗീത ഇതേം പോയാ കുഴപ്പമില്ല. വി വിൽ കോൾ ഇറ്റ് എ ഡേ, ഡോണ്ട് വറി.
Can we conclude, Krishnakumar?
ഗീത പറയണ്ടെന്ന് സാർ ആദ്യം പറഞ്ഞതാ.
Hello.
ഗീത വന്നോളൂ. ഗീത വന്നോളൂ.
Okay, thank you, sir, for that very lucid presentation, and you brought into focus the importance of premarital counseling. I always did think that this is an area which we have not yet thought of. So usually, sir, you come up with new ideas every few years. So this is another new idea, which definitely we should put our heart and soul into doing. And actually, we have a lot of data on families who are affected with various types of disorders. And actually, in the premarital counseling would do wonders for these families. So many families with repeated deaths and all that. And that's really something for the future. Thank you so much.
Thank you, brother.
I think we'll
Mohandas, sir, conclude ചെയ്യാനായോ?
conclude ചെയ്യാം.
If
അജയ്,
so,
സിന്ധു ഉണ്ടോ?
സിന്ധു എനിക്കൊന്ന് ഇല്ലാന്ന് തോന്നുന്നുണ്ട്. ഐ തിങ്ക് സർ വൈസ് ചാൻസലർ എന്നുള്ള നിലയിൽ MK സാർ ചെയ്ത ഏറ്റവും നല്ലൊരു കാര്യമായിട്ട് നമ്മൾ ഓർക്കുന്നത്, ഹി സ്റ്റാർട്ടഡ് സോ മെനി ഇന്നോവേറ്റീവ് കോഴ്സസ്. ഇപ്പൊ നമ്മുടെ MPhil സൈക്കോളജി കോഴ്സ്, സോഷ്യൽ വർക്ക് കോഴ്സുകൾ, ആൻഡ് ലോട്ട് ഓഫ് സർട്ടിഫിക്കറ്റ് കോഴ്സസ് ഫോർ ഫാക്കൽറ്റി ഇംപ്രൂവ്മെന്റ് പ്രോഗ്രാം, schools of disability studies, counseling, youth, counseling of youth, adolescents and youth. And one thing is that all these programs which you have started are now doing well. അതൊരു സാർ ഒരു തുടക്കം കുറിച്ചത്, and now it is because you have trained the next generation people also well, and all these programs are doing well. So that is something which we always used to say. So over to you. Thank you, sir. And over to Mohandas, Ajay.
Okay. So I would like to extend our gratitude to MKC sir for being with us. സാറിന് കഴിഞ്ഞ ദിവസവും തീരെ സുഖമില്ലായിരുന്നു. അതിൻ്റെ ആ ഒരു ക്ഷീണത്തിനിടയിലും നമ്മുടെ ആ ഒരു ഡേറ്റിൽ കൃത്യമായിട്ട് സാറ് നമ്മുടെ കൂടെ വന്നു. അപ്പോൾ സാറിന് നന്ദി പറയാണ്. ഈ പ്രോഗ്രാമിൽ നമ്മുടെ കൂടെ ഉണ്ടായ എല്ലാവർക്കും, DK സാറ്, പരമേശ്വരൻ സാറ്, മനോജ് നാരായൺ സാറ്, കൃഷ്ണകുമാർ, ഗീത, അജിത്, എല്ലാവർക്കും നന്ദി പറയുന്നു. താങ്ക് യു.
Good night. Good night.
Good night.
Good night.